Can vampire facials be done on black skin? Are there any concerns for hyper or hypopigmentation with black skin? What are the complications with vampire facials on black skin?
Thank you for your question. You submitted a photo and you're asking, is the vampire facial safe for black skin? Well, I think that I can certainly help you with this. To give you a little background, I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic surgeon. Treatment of ethnic skin has been a very significant part of my practice. I wrote articles years ago on ethnic considerations with eyelid surgery, and so I can certainly give you perspective on this. I have been a member of the Vampire Facelift network for many years now, and have been pretty prominent in that respect when media has come to me regarding this treatment. So let's start by just defining the difference between the vampire facelift and the vampire facial. This has been a source of a lot of confusion, so I just want to just clear the definitions first. A vampire facelift is the use of combination of one syringe of a hyaluronic acid filler, such as Restylane and Juvederm, and placed strategically to help accentuate certain parts of the face, such as the outer part of the brow, the cheekbone, and the outer corner of the mouth. Now that is done in combination with platelet-rich plasma, which is derived from your own blood and has this remarkable characteristic of being able to stimulate collagen and stimulate blood supply. It's basically doing what it does for you naturally whenever you get a cut, which results in a little scab and creates what's called a wound healing response, and that requires restoring the integrity of the area of tissue that is traumatized. So it means building collagen and stimulating blood supply. So when a patient has this treatment, they love the combination of the immediacy of the volume correction with the global improvement in skin quality, in particular the skin glow that comes from the benefit of the PRP. So it's really a great combination. Now, a couple of years after the development of the vampire facelift, the application of PRP with a device called a microneedling device became coined the vampire facial. And this was a result based on the idea that you can take a microneedling device, which is based on the same technology that derma rollers are, which is to create little tiny openings in the skin, and then to use platelet-rich plasma to basically apply over this area and get this skin rejuvenation result. So when you ask if it's safe for darker skin, and you expressed in your question the concerns about hyper and hypopigmentation, I would say first ask yourself, what do you want to achieve? And if we're dealing with some surface irregularities and some small areas of pigmentation, you may not want to take that risk, because darker skin, and it's not just black skin, but anybody with significant melanin, I would say anybody who has olive skin or darker, is always at risk for hyper or hypopigmentation. So there has to be a justification for the use of a device that disrupts the integrity of the skin. In my practice, for most of my patients, and I have a lot of patients with darker skin, what we do is we do the vampire facelift, or we just do PRP injection under the skin. We have many patients who have all kinds of issues with pigmentation, and interestingly, because they are not good candidates for laser, we actually use PRP, and we have found that it helps areas of hyperpigmentation resulting from sun damage or chronic sun exposure from the past. So if that's what you're looking for, then you're probably better off getting PRP injection with or without the vampire name. But I would caution you because you are at risk of hyper or hypopigmentation. If I'm going to consider doing the vampire facial or do a combination of micro needling with the PRP treatment, I do test areas. I test a small area that's a little bit away from the center of the face if I can do it, and just do a small test area to see how the skin responds. Plus, we have to understand with microneedling there's various depths, and that is customized based on the type of issue that we're dealing with. So again, if it's a global complexion improvement, I'd say the PRP injections under the skin is ideal. If it is something more specific, then it requires, I would say, some testing before moving forward with that treatment. So I hope that was helpful. I wish you the best of luck. Thank you for your question.